So we're going to talk about our school-based dental program. In the fall, we provide dental screenings. Dental screenings are recommended for all children, including children who see a dentist annually or biannually. It's just a visual inspection. It's non-invasive. We don't use take any x-rays. It's just a mirror, and we look in there and write down our key findings. And then we send a card home with the family that lets them know if we found any dental concerns or not. We provide fluoride varnish applications. If you're not aware of fluoride varnish, most kids get it at the dental office. It's a sticky paste that's painted on their teeth to help protect them against cavities, but it also helps with tooth development and bone growth as well. So we recommend fluoride varnish applications, again, for all children, even if they see a dentist. They can receive 2 applications at the dental office and 2 through us to get 4 applications total per year, which is the maximum benefit of fluoride varnish. But our program really is to at least provide some dental service for those kids who do not get to go see a dentist regularly. So getting at least 2 applications of fluoride varnish each year is really important for them if they're not being seen regularly. So a consent form is needed for fluoride varnish since it's a medication. So we ask the school nurses to send those consent forms home. The parents will fill them out and return them. Yes, if you remember on the forms, we do need that box checked in a parent signature at the bottom. So if you get any semi-blank or not completely filled out permission slips, you might call the parent beforehand, so we're not calling the day of dental screenings. Fluoride varnish, again, is recommended for all children. And we provide oral health education in the spring. That's whenever we also apply the second application of fluoride varnish. Every kid in the school, regardless of participation, maybe they're absent, maybe their parents decline services, they'll still receive dental goodies: toothbrush, toothpaste, educational material. Now, since this is provided by the state, the Department of Health and Senior Services funds our fluoride varnish applications and our dental goodies. We have to place the orders 3 to 4 weeks in advance, so you may receive that shipment quite a bit earlier than you anticipate, and you may not have that room in your nurse's office to store our big boxes. So you might ask the custodian if they can hold on to them for just a little bit until we come. Screening packet. So this year we're modernizing. It'll be sent via email, and there are a couple small changes, nothing too dramatic. We have the classroom schedule where teachers sign up their classrooms for a 15-minute time slot for their dental screening, and also the screening timeline on the same page. So if you can see this right here, I just kind of copy and paste your all's logo on there, and underneath you'll see a Word document. So you just click on it and your classroom schedule will pop up. So from here, I know Kristen Redmond had wanted our forms to be electronic, where you can share with your school, with your teachers, so they can sign up electronically versus through paper, hard copy. So either you could print it off and put it in the break room and have teachers sign up on a hard copy, or you might try saving this document to your Google Drive or your SharePoint, whatever system you use. Then you can share that document with your teachers. So you may try that if that works. I know it works for SharePoint. Our classroom schedule, and just one teacher or one classroom per time slot, unless they're smaller classrooms. So at the ESC or ECC, excuse me, we have smaller classrooms where we could do 2 or 3 in one time slot. Or in your elementary school, if you have special needs classes that have like 10 or less, we could probably fit 2 of them in one time slot. So our screening timeline is really for you to use as needed. I mean, most of the school nurses here have been there, done that. You have your own system of like how you want to prepare for us coming in. But if you needed some friendly reminders, like 1 month before, it breaks down some of the work that we ask of you. We do need 3 volunteers per day of dental screenings. If you are having difficulty finding volunteers, let me know. We could put it on the North Kansas City portal. We also have Concord Career College students. They're going to be dental hygienists. We have them come in and volunteer, which is great because they've already applied fluoride varnish and work with children. We also have volunteers around the community. So we're trying to increase the amount of people that we have available to help out with dental screenings so it could take some at least weight or stress off of your all shoulders. So on our screening cards, those labels I have to make, you know how we said we want the child's name, first and last name, and the teacher's name and the grade. That's because whenever a child is absent the day of screening and they come to us the next morning for their screening, we at least need to know what teacher that card goes to and what card that should go to that child. But the screening date is optional now. So if you want to leave that off, feel free to. We thought that's quite a bit of text for one small sticky label. And after dental screenings has updated as well. We provided a quality improvement process. We had and other school nurses, district nurses, to improve the quality of follow-up, increase the amount of children who are screened with urgent dental care needs, who actually see a dentist and receive the treatment that they need. So hopefully this year, the process will increase that number and we'll see more children receiving dental work here in Clay County. So instead of the dental hygienist at the health department and the school nurses calling, we have replaced that with follow-up letters, and this is what the follow-up letter will look like. So it reinstates that the child has urgent dental care needs, and it requests information back from the parent. So they check a box if, yes, my child has received treatment, or yes, my child has had an exam, here's the treatment date, or I need some help, I need additional resources. So if a family marks, I need additional resources, that's immediately where you provide them the dental referral, and I'll have one for you. Miles to Smiles provides free dental work for children who are or families for 200% of the poverty level. We have the dental screening. Michaela and I will have our dental screening card, mark the appropriate box if there's a dental concern, and we'll send home a referral. And then we'll leave 2 of these letters with you all in your office, so you can send the first letter 1 to 2 weeks after the dental screening, and the second one if you don't hear back from the parent or if that child hasn't received treatment, another a month or 2 from then. And hopefully we'll see an increase in the amount of children receiving treatment. Because sometimes Michaela and I, some of the children that are lost are the parents who may have already taken their child to the dentist and received treatment, but we just never find that out. So hopefully this will alleviate that issue. So again, 1 to 2 weeks after, and then 1 to 2 months after. I'll try to send you all reminders. I have my little reminders to send reminders on top of reminders. They seem to help. These are our providers that we have for a referral, so I can send this to everyone here in this room. Miles to Smiles, again right here, they have not only a brick and mortar place, but they have a school-based program where they go into a few of the elementary schools around Clay County and provide free dental care. So the children with Medicaid, children with insurance, children uninsured, children underinsured, every child is welcome through Miles to Smiles if they meet or exceed that 200% poverty level. Rogers Health would be the second or the next one I would refer to. They can do a sliding fee scale, so depending on your income, make dental work more affordable for families. We have pediatric dentists on the right-hand side, so dentistry for children, Children's Mercy Hospital. If we have a child that needs extensive surgery, we're most likely going to refer over to them because they provide anesthesia and can put the child under so it's not traumatic, the dental work that they're getting done. So you may wonder what consists of an urgent dental care need or concern. So a really large decayed tooth with pain, with infection, swelling. I've seen a tooth like this and the inside of the tooth is bleeding. So this is an urgent dental care need. That decay has reached the pulp and create abscesses, infections, and very painful for the kid, which can cause multiple days of missed school, not paying attention well in the classroom, ER visits when it could be completed at the dental office. Also rampant decay. So this is a child that has 7 or more teeth with cavities or decayed lesions and abscesses. So even if they just have one abscess by the tooth, it's an urgent concern and we're going to refer out. Every once in a while, there'll be a baby tooth like this that's about to exfoliate, so it's about to wiggle and come out, and it'll have an abscess there. So we'll kind of use our professional judgment. Is it wiggly now? Is it going to fall out? Or are we going to refer urgent exam to be done? Or are we going to just write on the card, well, accept baby tooth, and hope that it comes out fairly quick. All children who are screened with urgent dental care needs, and you'll see we have borderline urgent, because Michaela and I don't want to leave these children out. You know, if they're screened with they're almost in pain with a large tooth or almost infected, most likely within a couple weeks or a couple months it's going to be infected. So we add them to the list as well. So this is, these are notes for us. In the notes section, we write shorthand, so if you ever need to know any information on that, let us know. We could provide that information to you. We'll give you a copy of that, of course, for your reference, and then you can use this page along with the dental referrals to send referrals back and forth from the parent. Whenever you get a dental referral, you can send it however FERPA allows, okay, or your school. So through email, if it's encrypted, I'm not sure how much information this entails, but it'll have the child's name. You could probably put the initial of the last name on there, and we'll know exactly who that is, right, from your school. So that's not too much information on there. It's, nothing that would be of concern for HIPAA, at least. I'm not too certain on FERPA. Okay, so case management. So let's say a child is underinsured child, or a family just really needs dental help. Some families have private insurance. They go pretty regularly, or maybe they moved into this area, but their child needs extensive dental care, and then they have $5,000 that they have to pay on top because of their copay and deductible. So first thing, if a family needs referral or assistance, so this goes for every school here. If a family needs help, again, refer to Miles to Smiles, see if they can help. They do a eligibility screening over the phone, and if they're not eligible, they'll let them know and won't even schedule an appointment. But so Miles to Smiles, they don't do general anesthesia, so if they have additional work to do, or maybe they have a private dentist but need help paying for the anesthesia, because we can fill out an application through the First Hand Foundation. If you've heard of that, it's through Cerner. It's a grant for families, children 18 and under. They can have one grant per year. It's medical as well. So any kind of disability device or medical device, dental work, any kind of medical or dental need, this foundation may be able to help financially for that family. The First Hand Foundation, if you want their contact information and who we call, let us know. You may already have it. But we would work as the middleman. So we would contact the parent, get the information, fill out the application. We'd send that off to First Hand Foundation, who would then contact us and then contact the family. We would make the dental appointment. So it's making sure that family is being seen and being treated. We had one this year and one last year. One this year was rewarded the full amount. And the one last year, we actually had two last year, they were rewarded 73% of the amount. So it made it quite a bit more affordable for them. So any questions or any tips or advice or things that you'd like to see from the program to make it easier on you, on your workload? I know those sticky labels, especially if you have a lot of children in your school, is kind of tough to find time to stick labels and manage. If there's any way that we can maybe, for example, have the teachers write the child's name or put the information on the card and then turn those cards into the school nurse, something that you've thought of before that can ease the load off school nurses for preparation, let us know.